Hello, good afternoon everybody. I'm Dr. Begal, a radiation medical oncologist, and we have Begal Hospital in Mohali, Punjab. And today I'd like to talk about the side effects of radiation. Whichever type of radiation you may be having, whether it's 3D conformal, 2D conformal, IMRT, step and shoot IMRT, IGRT, radiosurgery, brachytherapy, there will be some side effect. No matter what the clinician or the doctor or the hospital advertises or says, there will be some side effect. Ulceration mostly around the tumor, where when the tumor disappears, when it shrinks, that area is also going to get denuded, is going to pain. Whichever area, the skin, the esophagus, the nose, anywhere the tumor is, it will cause pain. And to take care of that, there is a simple rule of thumb. Hydration is very important. A lot of fluids are required. Salt and rock salt. I prefer rock salt. Sorry for the disturbance. And water, salt and sugar. These are very important for immediate rejuvenation. For immediate rejuvenation of the body. And short-term albumin, proteins which you take from normal diet. Basically diet does not have to go down. Whatever happens, diet should not reduce during radiation therapy. Water is very important. Salt, sugar, proteins, carbohydrates, very important. There shouldn't be no depression, no tiredness. I avoid patients walking too much or coming on a daily basis. Patients who are too far or too poor, we keep them admitted on a free basis so that they have complete rest. And usually in a hospital, because of the cost factor and somebody, if it's a poor family, there's somebody who's doing labor or a daily wage worker. So we advise them, if it's a gents, we keep them alone here. But for ladies, usually we prefer somebody to be here at all times. And simple nutrition is very important for the patient. Otherwise, we give them simple IV fluids. They cost hardly anything, so we charge them free of cost. So, and nutrition is probably the most important aspect of radiation therapy. And when you give chemotherapy along with it, doing that on an OPD basis is practically criminal. And we get a lot of patients who are given chemotherapy and radiation on an OPD basis, and they're supposed to be eating properly at home, which is not possible. So we have to convince the referring doctor, the medical oncologist, or whoever has sent the patient to keep the patient admitted at a minimum cost or free of cost, just for simple fluids, for nursing care. Nursing care is very important during the treatment. And I'll continue on this later. But nutrition is so important that most of our patients are scared, most doctors are scared of radiation therapy, but it's a very simple solution. And this will be part 1 on the radiation side effects, and I'll go into it with some illustrations. I know I don't want to give you boring talks. Stay tuned, and if you like it, please subscribe. Thank you very much.